to be honest. So I guess we're all quite conservative. We want to have a lot of literature to make a change in our patient management, which I can understand. There is a lot of literature now, so that should be convincing. Then of course it's hard to admit that something is better than your eye, which you've already been doing for maybe 10-20 years. I understand that, and you have to realize that in some countries the financial issue is of course important. Very black and white. If a urologist does a test, he has to pay for the test, and he doesn't get the money you will get for a cystoscopy. So only when it is arranged well, and for example the APCheck test has been approved by the insurance companies last October in the Netherlands, so 1 month ago, and if that is done well, of course the financial initiative will disappear. Because again, concluding, I think those markers are good for patients, it's non-invasive, they're very good, they're maybe better than we can see with our eye. It's cheaper in all if you count everything. So I think that certainly is the future. We just have to convince patients also, but also the urologist. Well, basically what I've been doing just to start alternating, because just to switch suddenly from all cystoscopies to all biomarkers, I can imagine that a patient isn't confident, that a urologist is not confident, but if you alternate that, you build up your own experience, the patient builds up his own experience. And for me that has been working very well. We're now using that since the beginning of 2020, so that's almost 4 years. And again, we looked at the patient's quality of life, and that's really very good, so they're very happy with that. Just slowly implement that test. And make a lot of noise if you are a patient advocate, or make a lot of noise if you are a company, because again, the tests are good.